maggot therapy, maggot debridement therapy, MDT, but she did know about the syringe. Although she knew more about the insulin syringe. This is not an insulin syringe. Adele, as you know, was being treated for diabetes, type 2 diabetes with left diabetic foot ulcer. And as the endocrinologist came to visit her, all she thought in her head was, I just hope they're not going to prescribe more and more insulin injections for me. I hate these things, and I have to have them every day, punctured into my body. Even though the insulin syringe is a bit smaller than this, it's narrower, it's less painful, but nevertheless, it is still a prick, isn't it? And so as the endocrinologist reviewed Adele's latest results, he was a bit happy. And he said to Adele, Adele, I like the fact that your blood sugar has been coming down consistently. However, I still need to keep on readjusting your insulin dose because you know the ongoing infection in your left foot, your left ankle, your left toe, your left second toe is still ongoing. And because of this, we need to control the blood sugar. And so, yes, Dr. Adele said, am I still going to be on that insulin injection? I'm tired of my body being pricked. The endocrinologist laughed. He said, Adele, just be patient, okay? You'll soon get better, and the pricks will be less frequent over time. And maybe even you might be lucky. You might be placed on oral medication, that is medication by mouth, very soon. So be patient. And so as the endocrinologist left Adele, she was left to ponder over this. But she didn't have time to think over this because guess what? Another specialist came to see her. The group came, the group of the orthopedic surgeons, yes. As they walked towards Adele, the group of the orthopedic surgeons in their white ward coats, there were quite a number of them. Anyway, she said, I know that they said that there's money in orthopedics. That is why there's so many of them coming to see me. So all these doctors want to be all these doctors are orthopedic doctors, or probably, well, I'm sure there's some young doctors in training to be orthopedic doctors. And so she patiently waited for them as they approached her bed. The most senior, well, he looked like the most senior orthopedic surgeon, greeted her, and then he introduced his team to her, from the most senior to the youngest. And he said, Adele, we're going to have a look at your x-rays with my group of doctors, and we're going to explain to you what is going on in your leg. And so as he picked up the x-ray, Adele looked keenly at the group of doctors as they looked at her leg x-ray, her leg, ankle, and foot x-ray, specifically her left leg, the leg that had the problem, the diabetic foot ulcer. As they were looking, they were discussing. Some of them would point at the bone. Well, she guessed it was the bone because it looked white, and the outline looked like her leg and her ankle and her foot and her toes. Others were looking, pointing at the blackish areas around that bony area. So they went back and forth, discussing. Finally, after a few minutes of discussing back and forth, they turned to look back at Adele. Adele, we have some good news for you. Adele said, what is the good news, doctor? And she looked at the most senior doctor in his eyes. Well, Adele, I'm pleased to say that your bone looks relatively healthy. What does that mean, doctor? What do you mean it looks healthy? Do you mean that my leg will not be cut? Tell me in plain layman's terms. I don't want long English. And the group of doctors all started laughing at Adele. They said, well, Adele, it looks like there is no active infection going on in your bone from what we can see. However, I knew it, Adele said. There must be a problem. They laughed again. And they said, Adele, please calm down, okay? What we have confirmed from your x-ray is that your ankle, your left ankle, is not too healthy, okay? We can see your right ankle is looking relatively healthy compared to the left ankle. And the reason why we think that is so is because, yes, we have told you before, you seem to have, or should I say, the other doctor that has been seeing you, the medical officer that has been seeing you, had discussed with you that you had Charcot's foot, right? She said, yes, doctor. He has explained everything to me about Charcot's foot, yes. And so we have confirmed this from this x-ray, of your left leg, showing your ankle and your foot, your toes. You do have Charcot foot, which is a complication of diabetic foot ulcer, of diabetes. And so we need to manage that. We will give you specific instructions on how to manage that so that the abnormalities do not get worse. Okay? Thank you, doctor. So what about my toes, my foot, my leg? You've talked about my ankle. Yes, as I said before, there's no active infection ongoing from what we can see from the x-ray. We don't know about later because sometimes some changes may show later. So doctor, what are you saying? Is it good news really? Because that means that maybe later on you might see evidence of the infection in the x-ray. Is that what you're saying? They all smiled. Yes, Adele, that is possible. However, it's unlikely from your general condition, from the improvement in your limb. Your wounds are looking cleaner. I'm sure you can see that they're looking redder than ever before, and they're closing up. They're getting smaller. I'm sure when the plastic surgeon comes to see you, he'll tell you the same. Or rather, she will tell you the same. She's actually a female. Oh, she's a female? Yes, she is. And she's very good. So just hold on for her. I think we saw her as we were walking into the ward. She's a patient over there. And so, as the orthopedic surgeons left her with this seemingly good news, so they said, Adele waited for the review by the plastic surgeon. Meanwhile, she saw the young porter coming on into the ward. Oh no, she thought, he's bringing me that nasty diabetic menu for me to choose from to choose my lunch. Adele had initially loved the diabetic menu when she first came to the hospital. However, as time went on, she had decided that she was tired of eating steamed vegetables, steamed bean pudding, boiled meals, small quantities of meals. She was missing her fried chips, her fried yam, her spicy pomo, cow skin, and goat skin soup. She was missing it. Not to talk of the lovely icing cakes she shared with her granddaughter, her namesake, baby Adele. In fact, they were about to visit her today. I think Sam said he was going to bring the kids, including her favorite granddaughter, her namesake, Adele. Anyway, she thought, she still kept on thinking as the man was walking towards her, as the was coming towards her with the diabetic menu, the menu for today. She was missing her icing cakes, her puff, her donuts, her biscuits. Oh, when will I eat those things again? She thought. Who knows? Is it possible she'll be able to eat those things again? Let's see as time goes on. And so he bought the menu. And reluctantly, she chose her vegetables. She chose a little bit of pap, commonly called Tom Brown, and a little bit of, sauteed by the side. Anyway, I'll get used to it, she thought. And as Timmy's girlfriend nurse approached her bed to open wound, Of course, the endocrinologists had seen the wound and the orthopedic surgeons had seen the wound. However, they had not completely closed the wound. They had put drape, a sort of a Macintosh, a waterproof material to cover her leg, because they knew that other doctors would come view her wounds. And that was what was going to happen very soon. So the young nurse said, Adele, I'm just here to sort of open your wound because the plastic surgeon is here. She wants to see your wounds and she wants to also review you and give you more advice pertaining your present condition. Adele said, let her come now. So many doctors have been seeing me. I'm getting tired of seeing doctors. Just when I'm about to sleep, another set of doctors will come. When I'm about to eat, another set of doctors will come. So let her come too. Maybe after she comes, I can rest after this. The young nurse smiled. But Adele, you know that it's for your own good now. And I'm sure you are happy by your condition, aren't you? Don't you want to leave the hospital quickly? I'm sure you're in a hurry to even leave the hospital because, you're getting better. And I'm sure you're tired of seeing our faces, our ugly faces. Adele said, you ugly. My son doesn't like ugly girls. And so you can be sure that you're not ugly. The young nurse smiled. Mommy, is it Timmy you're talking about? Of course it's Timmy I'm talking about, Adele said. Who else? And so as Dr. Suleiman, the plastic surgeon, walked towards Adele, she was walking with her own team of doctors. They were fewer in number than the orthopedic surgeons and endocrinologists, or rather the endocrinologist and his other physicians. But she could see that they were doing a lot of work on the ward, even more than what the orthopedic surgeons and the endocrinologists were doing. Because all those wounds on the wards, they went to review. And the other set of doctors only went to review a few of the patients there, meaning that majority of the patients on that ward were also being co-managed by the plastic surgeons, of course, in addition to other doctors. So Dr. Suleiman walked to her bedside, introduced her doctors, her younger doctors to her. Adele, how are you? Good morning. How are you feeling? These are my team of doctors. I'm Dr. Suleiman. I'm the most senior surgeon in the team. And these are my younger doctors, Dr. Kabuga and Dr. Nabigu, one on either side of her. And we're here to review you and give you a feedback and update on your condition. So how are you feeling today, generally? Adele said, Doctor, I'm happy to see you. I think you're one of the one of the few female doctors I've seen since I came to the hospital. So I'm happy to be talking to one of my own. You're welcome, said Dr. Suleiman. How is your wound today? Is it still painful as it was when you came? No, it has really been getting better. You can imagine when I came in, Adele said, it was black. That's my second tour, as you are seeing now. You're looking at now. It was so black, but now it's getting redder and redder. And even the other wounds at the back of my foot, as you can see, they're getting better and they're even less painful. In fact, I don't even think I need any more of those painkillers that I'm even getting for the wound dressings. Doctor, I don't need them. Please remove them from my prescription. Dr. Suleiman smiled and the other doctors laughed, as well as Timmy's girlfriend, the nurse. Yes, Adele, your wounds are definitely getting better. And so I hope that the other the other doctors that have been coming to see you, the endocrinologists, the orthopedic surgeons, and the rest have been giving you good news so far, because I also have some good news to tell you. Yes, it's not too bad, Adele said. At least they've not said that I'm going to have my leg cut off. So, hey, that is the big news to me. That is the biggest news. Dr. Suleiman smiled. She said, well, yes, remember that we did a test for you the other time when your results came out, the ankle brachial index, that is the ABI. Yes, I remember. I remember it was abnormal, doctor, said Adele. Yes, it was abnormal, said Dr. Suleiman. And remember that, the doctor that explained your test results to you had said that you need to do further tests, further imaging tests. You needed to do What he might have told you was a Doppler ultrasound scan of your leg, of your left leg, outlining the blood vessels there, the arteries, the veins. You know, it's very good in outlining the blood flow to that leg so that we anticipate or we know whether or not that leg is healthy and not diseased. Although from all indication, so far, it's not as diseased as we initially thought when you came to the hospital that first day. Yes, doctor. So what are the results? Are the results out? Are the results of the Doppler ultrasound scan out? The results of the imaging tests, right? Are they out? Yes, Dr. Suleiman said. And so what are they? Tell me. Yes, Dr. Suleiman said. Dr. Nurse, Dr. Nabegu, Dr. Kabuga, and the nurse, they all smiled. Well, yes, it outlines that although there is a narrowing of some of your arteries, your small arteries, Adele said, problem again? Hold on, Dr. Suleiman said. Although there is narrowing of your arteries, your small arteries, by what, said Adele? What is narrowing those arteries? Well, there are some small calcifications, that is like hardening. There's a little bit of hardening causing some narrowing of those blood vessels. Can you imagine? Said Adele. Yes. The narrowing is mild. Okay? It's mild. And so, even though we're going to call the vascular surgeon to review these results, we know from our training that this is not an indication for you to lose your limb. All right? There's some things that can be done to help your leg. So that is the good news, said Dr. Suleiman. Thank God, said Adele. At least the major, the problems that I had lined for me in the past, since I came to the hospital, should I say, are being solved one by one. Yes, Dr. Suleiman said. And so now we will concentrate, the plastic surgeons, on your wound. Remember that the doctor discussed with you prior to now that you had some evidence of infection in your wound, right? Yes, said Adele. Although it's not smelling as bad, so I know that it's getting better. Yes, said Dr. Suleiman, it's getting much better. And you best believe that the honey that has been used to dress your wound has been helping with that. Yes, doctor, I know. That honey is very painful on my wound, but I know it's doing a good job because even that smell is less. Even that discharge, that pus, that whitish thing that is coming out of the wound, is much, much less than before. And even the swelling, can't you see? I've been raising the leg on these pillows, on these two pillows as I've been directed to do. I've been doing it. And the swelling is less. Doctor, can't you see? Yes, Adele, said Dr. Suleiman. You've been doing well with your leg. But since that infection has been proven to be there, you need to be on antibiotics. We placed you on some antibiotics beforehand, before the results of the test came out. But now the results of that test, the wound swab, microscopy, culture, and sensitivity, has shown us the kind of infection you have, the type of organism that is causing that infection. And it has shown that it's a different type of antibiotic that is going to be used for that organism, because that bacteria that is causing this infection is more sensitive to a particular antibiotic that was tested when your sample of the pus from your wound was taken. Okay, so we're going to change your antibiotics. Even though there's an improvement, but we think it could be better. All right, so we're going to change your antibiotics based on this sensitivity result. All right, doctor, you know your job. So do whatever it is you think is best for me. Good, Adele. I'm happy that you understand. Also, Dr. Kabuga here, she pointed to him. He's going to come back after the ward rounds because we have a lot of patients to see. In other words, he's going to come back in the next 10 minutes to debride your wound. What is debride? What is debride? Dr. Suleiman said, well, debride just means he's going to clean up your wound. He's going to clean up and remove some dead tissue. You know those black things on your second toe, right? Even though they're less now because of the regular and frequent dressing changes, we still need to use some sharp objects. Sharp care, said Adele. Is it going to be painful? Not too sharp, Adele. Just some sharp dissection, some sharp debridement to remove those dead tissues. Don't worry. It's not going to be a knife, okay? It's not going to be a razor blade. It's not even going to be a scalpel blade. We're just going to use some of our instruments in our dressing pack to remove some of those dead tissues so that the dressing agent we're going to change for you now, because you know you were using honey to dress your wound before, right? Yes, doctor. So you mean you're going to change my dressing agent? Yes, we're going to change your dressing agent. What are you going to use now? Is it going to be expensive, Dr. Suleiman? I've been spending so much money on this, my wound. Is it going to be expensive? Mommy Adele, said Dr. Suleiman, hopefully you'll be able to afford this medication. And don't you want something that will make your wound clean up faster so that you can leave this hospital? Don't you? Yes, doctor, I do. As long as, doctor, I saw you cleaning up the wound of that woman in down this aisle, but her legs are worse than my own. Does she also have diabetes, diabetic foot ulcer, or is it cancer? Because those her legs. Do you know when they open her wound from afar? I can smell that her leg. I can smell it. It's so bad. Dr. Suleiman said, actually, she also has diabetic foot ulcers like you, but in her own case, both her legs are affected. That is how bad diabetic foot ulcer could be, Adele. Said Adele. Really? She has the same diagnosis as me? And her wounds are so bad. Yes, said Dr. Suleiman. That is why the way we're managing her is different from the way we're managing you. Okay? She is having a different kind of therapy, which we call MDT, maggot debridement therapy, or maggot debridement therapy. Maggot care, said Adele. You mean you put maggot inside her wound? Well, it's a complex process. Or should I say it's a complex explanation. But in short, Adele, there are different kinds of therapies for diabetic foot ulcers. And one of those therapies for wounds that are as bad as that is called maggot debridement therapy. So we use sterile medical maggots and place them on the wound to help clean up the wound. But Adele, you're lucky. You don't need that. Timi's girlfriend, the nurse, smiled. Really? Really? Adele? You're asking doctor about the other patient, that patient? But you know what has been going on now, Adele. You've been peeping, you've been seeing what they've been doing. I've been explaining it to you little by little. I'm sure you understand what is being done now. Adele. Adele said, I understand, yes. It's MDT, maggot debridement therapy. I'm also a learning doctor. I've been checking up things on the internet and I've read about it. It's really interesting. You people are trying. You people are trying. You people are trying. Thank you for all your help, okay? And so Dr. Suleiman said, but that's not all, Adele. So the dressing agent we're going to change for you is going to be a hydrogel. A hydrogel. It's very good. And guess what? It's not as painful as honey. And so when they're dressing you, doing your dressing changes, when they apply that hydrogel on your wound, after cleaning it up, it's not going to be as painful as honey. Oh, Adele said. She clapped. Dr. Suleiman, thank you for that. Thank you, Dr. Skabuga, Dr. Nabegu, Timi's girlfriend, the nurse. I love you. That's not all, said Dr. Suleiman. In addition to that, we're going to place you on some hematinics, some vitamins, some minerals, micronutrients. But what is that, said Adele. Yes, just some medication to help boost your immunity, to help with your wound healing, to enable you heal faster and leave the hospital as soon as possible in the shortest possible time. Okay? Adele, are you happy? I'm sort of happy. It's all doctor. There is more will be explained to you as time goes on, Adele. Do you have diabetes? Do you know anyone who has diabetes or has diabetic foot ulcer? If you do, drop the word diabetes in the comments below and watch this TMI story or this TMI signing out.